so I'm going to start with co-wipe. I'm going to check my physician's orders and my allergies. I'm going to assemble my equipment and assess my patient. I will wash my hands. I will identify my patient and introduce myself. I will provide for privacy. I'll educate, explain, and evaluate. So first off, I'm going to make sure my patient's in a comfortable position. I will make sure they need, so I would already have one on my patient, so making sure I need to change it. So when removing the bag, we'll use a special protective wipe because it's a very sensitive area. And you take this off. Well, you take the whole thing off, but you would just go around the edges, working your way around and gently pull that off. So now what you do is you take some gauze, which is warm water, and wipe the stoma clean. So then you can take a new gauze, irrigate the stoma, and this just helps to regulate the bowels. So now that the stoma is completely clean, you can also use a barrier when applying the stoma or the ostomy to help stick the wafer. But you will measure the stoma, and I've already cut out my hole to fit my patient's stoma. So I'm going to apply my gloves. I've washed my hands. Peel the wafer part off. Place that on there. Making sure it's a good fit and tight. Sticking it down, and then I'll peel the edges off and stick it as well. Making sure there's no gaps that air or leakage could get through. Then I take my bag and I'm going to just pop that right on there. And then if you have a clip, you would clip it, or you can roll it down into the little protective case. Make sure it's all even. Everything's good. Take off my gloves, wash my hands, and I will document my procedure.